Hi there. My name is Dr. Raj Chovatiya. I'm an associate professor at the Rosalind Franklin University of Medicine and Science Chicago Medical School and founder and director of the Center for Medical Dermatology and Immunology Research in Chicago, Illinois. So, when we think about everywhere that we've come with atopic dermatitis, I think that we still have this existential dilemma every time we see a patient. Is this a topical patient or is this a systemic patient? And I think that, we've kind of had this discussion given that for a long time, pretty much all we had in our hands were generally a bunch of steroidal and some older non-steroidal topicals. And really when sort of systemic started entering the fray, it became really exciting to figure out, okay, we're going to be able to help people. We're able to help before, but then topical technology started getting advanced, including topical JAK inhibitors like ruxolitinib and roflumilast, tapinarof in the PD4 world and AHR world as well. And so then this question's become even more muddied in terms of who exactly is my patient that's going to benefit from an advanced topical therapy versus a systemic therapy. And so I think that more often than not, when we have patients that come to see us in the clinic, topicals are really where their mind is at. Atopic dermatitis is largely a disease you can see on the skin, redness, swelling, lichenification, excoriation, and the idea of being able to apply easily a topical medication to areas of interest inherently just clicks with the atopic dermatitis patient. So I think that there's a utility aspect that really makes us think about trialing topicals first. Then there's the fact that at the end of the day, people want to build a treatment around their life. With topicals, you can kind of pretty easily do that, especially given some of our advanced topicals that have really great data that show that you can kind of use them as needed once you're under control. When thinking about systemics, sometimes you don't really have that type of flexibility, and that can also be an impediment for our patients too. Finally, the idea of speed and depth of response is really something that we only used to win on when thinking about systemic therapies, but topicals can actually hold that torch quite well. So I'll give you an example. If I told you that it was possible for a topical therapy to show itch response within minutes and actually have significant data in terms of lesional clearance really within a few days of using it, you think I was crazy. But that's actually data that you can find, for example, from topical ruxolitinib, a topical Janus kinase inhibitor. And if I told you that, you had involvement of really burdensome locations like the hand or the head and neck, around the eyes, really tricky to treat those with topicals, we got to think about a systemic. I'd push back again. We actually do have really great data that can show treatment of hand eczema or treatment of facial dermatitis or eyelid eczema can also be handled quite well with a topical therapy that's in the advanced targeted category too. So I feel like this discussion of is this a topical patient versus is this a systemic patient has actually evolved, and no longer really is it sort of an either or. It really feels like with our newer advanced topical therapies, pretty much every patient is actually a topical patient. And it's more or less trying to figure out when you're going to need systemic therapies in those individuals. And it's amazing that we've actually been able to sort of wedge these newer therapies and almost delay systemic therapy in our patients as well. So, bottom line, I think that when you think about the utility that an advanced topical can offer a patient, when you think about speed, efficacy, we didn't even talk about safety, but come on, topicals, there's really not much to counsel your patients on when thinking about sort of the safety argument. When you're really thinking about treating some of those sensitive and special sites and really building a plan around somebody's life, topicals win time and time again. So I think that remember when you're having that discussion with your patients, really emphasize how far we've come with newer topical therapies and use that as a bridge to figure out who is that patient that eventually may or may not need a systemic therapy in the future.